effort at rolling out a vaccine has sort of been waylaid by the story of vaccine wars. This is what happened. Bharat Biotech CMD Dr. Krishna Ella held a press conference yesterday to try and answer some of his detractors and some of the questions that have come his way as to why his COVID-19 vaccine has got an emergency use approval without the completion of crucial phase 3 clinical trials. In this process, it somehow devolved into a situation where Dr. Krishna Ella took pot shots, and plenty of them, at the AstraZeneca, Oxford and Serum Institute of India vaccine, questioning several times whether their clinical trials were conducted properly and whether the same standards were being applied to the scrutiny that this vaccine had got vis-a-vis his vaccine. Well, a day later, that's the only news that dominated the headlines, isn't it? That Bharat Biotech has hit out at Serum Institute of India, and it seems they have decided to kiss and make up. A joint statement was put out today by Adar Poonawalla of Serum Institute of India and Dr. Krishna Ella of Bharat Biotech. Neither side has come out and spoken since then, but the joint statement pretty much says that both these players and these large vaccine makers have a combined intent to develop, manufacture and supply the COVID-19 vaccine for India and globally. They talk about the important task in front of them of saving lives and livelihoods of population. And also in the last paragraph of that joint statement, say that they respect the great work being carried out by each other and put behind us the miscommunication and misunderstanding caused during the past week. So there's an attempt to bury the hatchet very publicly, but let's take a deeper look at what's at stake and what are the big questions that still remain. The fact is that two vaccine makers right now in this initial phase are competitors in this market. Both of them are vying for huge contracts from the Indian government and then private players going down the line. In fact, over the next few months, you're likely to see more vaccine candidates come aboard, and effectively they will all be competitors to each other. There will be comparisons between the individual vaccine candidates, which one's better, which one's cheaper, which one's safer, and which one has effects that last longer. So these questions will arise. The war of words which took place had Dr. Krishna Ella of Bharat Biotech raising some serious questions about how long the Oxford vaccine's impact will last. Like he said at some point, can you use the same vaccine next year if there are new mutant strains? And in his view, the answer is no. He also raised the question of whether paracetamol was being given to candidates during the clinical trial of the Oxford vaccine, which could suppress some of the side effects. He claims that he is not doing that in his clinical trial. On the other hand, questions abound about the Bharat Biotech vaccine as well. Where are the clinical trials for phase 3, which is supposed to be the large human trial, which also gives you efficacy data? That is still underway. So why does it have an emergency use approval without that data? Where are the articles which are usually published in peer-reviewed journals as a standard practice when there is a new medical discovery or a new vaccine? Dr. Krishna Ella says it will be out on January 10th. We'll have to wait and watch for that. So these questions still abound. So let's not get confused by the vaccine war and then this joint statement burying the hatchet. The real story and the real concern always has been to ensure, we're not saying it's not happening, but to ensure that there is a safe vaccine being rolled out for the Indian public, which checks all the standards and procedures, even if you're in the middle of an emergency situation and a global pandemic.